Increases in PCV are termed polycythemia or erythrocytosis, and these increases can be relative, which we've talked briefly about when we've talked about splenic contraction. That's one of the differentials. And then absolute. And of course, relative means just that red cells essentially move from one place to another, or there's less of the water component of plasma concentrating the rest of the red cells. And then absolute causes are going to be actual increases in total numbers of red cells in the body. So dehydration is, I think, a pretty self-explanatory concept, but I'm going to go through it anyway. So if you have blood and you spin it down, we talked about this before, you have a red cell component, that's your white cell component, and here's your plasma component. And within your plasma component, there's a lot of water. And so when an animal becomes dehydrated, they actually have less of this water component, which results in less water component. And then what a PCV is, or a hematocrit is the relative amount of red cells to the amount of plasma. And so you can see right here that it's now increased. If our number was higher, if that's where our plasma was before, and perhaps our PCV was, 45%, now it comprises most of it, and maybe we're up to 70%. So it's a loss of plasma water. And how you actually identify that is you look for increases in other things that increase because of that lack of water. So along with the increase in PCV, you're going to see an increase in your total protein, and you're going to see concurrent increases in albumin and potentially globulin that should mirror one another. You can see increases in sodium and chloride. They're the primary electrolyte within the plasma, and so they increase. You're going to see an increase in urine-specific gravity because, of course, if you went without water all day, your urine concentrates to conserve water. And then you may or may not see azotemia because you have a decrease in the amount of blood flow that's being filtered by the kidney. And of course, it's coupled with an increase in urine-specific gravity so that you know that the kidney is functioning. So again, those numbers for increases in urine-specific gravity are greater than 1035 in the cat, greater than 1030 in the dog, and greater than 1025 in large animals. So we've talked about redistribution, and each redistribution is related to epinephrine and the spleen. And remember that the spleen is a reservoir for a lot of red blood cells, so my red cells, and a lot of platelets. And so with epinephrine, you get both splenic contraction and you get an increase in heart rate. Just think about when you're scared. And so a few things happen. You get a release in all these red blood cells, which increases your PCV. You also get an increase in the numbers of platelets. And the increase in heart rate, actually, some of your white blood cells hang out on the walls of your blood vessels. So you can see an increase in mature neutrophils, and your lymphocytes also can increase due to different mechanisms. So increase in lymphocytes, increase in mature neutrophils, platelets, PCV, and you can also see an increase in glucose. Kind of the classic poster children for redistribution are going to be young animals and cats and horses in general. They tend to be highly spirited and can get splenic contraction anytime they're scared, as can we. And if you think it in terms of survival, of course you want more red cells to get away from whatever it is scaring you. You want glucose for your muscles and platelets in case whatever's getting you is going to cause you to bleed. So absolute causes of polycythemia include primary causes and secondary causes. And primary causes are extremely rare. This is bone marrow, and you get actually an increase in red cell production, and it's neoplastic red blood cells. And so you get tons and tons of red blood cells, and this we call polycythemia vera, and it's actually a neoplasia of mature red blood cells. And the most important thing to remember is that it is exceedingly rare in a diagnosis of exclusion. Secondary causes, on the other hand, are more common, but relative causes of polycythemia are still the most common. So let's go through some secondary causes just so you know them. So secondary causes are broken down into appropriate and inappropriate. And appropriate causes mean that your body is making more red cells in response to an increase in oxygen, whereas inappropriate would be that it's making more red cells in response to an increase in erythropoietin that's very uncommon due to like an erythropoietin secreting neoplasia. So we're going to put parentheses around that because we're going to mostly ignore it. So appropriate causes, so chronic hypoxia could be high altitude. So if you are up in Mount Everest or your patient moves from, sort of sea level up to the mountains. It could be due to something like lung disease, especially chronic lung disease. Or it could be due to heart failure, such as a right to left shunt can cause this, congestive heart failure. Any of those could cause chronic hypoxia, leading to an increase in erythropoietin and polycythemia. We can see this sometimes in some of the vascular anomalies that we see in very young animals, especially when there's a right to left shunt.